My name is Scarlett Lin Gomez. I am a professor in the Department of Epidemiology and Biostatistics here at UCSF. I have several other roles. I'm also co-leader of our cancer control program within the Helen Diller Family Comprehensive Cancer Center of UCSF. And I also direct the Greater Bay Area Cancer Registry. I'm a first-generation Taiwanese American. I immigrated here when I was very little from Taiwan, and my Chinese name is Ling Sijia. I've always had an interest in studying cancer in Asian Americans. My undergrad in college, I was pre-med bound at the time, but I had a lot of curiosity about society and cultures among Asian ethnic groups and the idea of trying to understand how these different cultures and lifestyles interact or intersect with disease risk. So I found myself taking a lot of courses in Asian ethnic studies. At the time, there were no degrees in public health, so this was apparently my attempt of trying to craft a public health training for myself. I was a major in biochemistry, but I was really interested in trying to better understand societies and cultures to understand how these factors can contribute to disease. Really, my interest stems from personal experience, specifically within my families and my communities with cancer. I think like all Asian American families, really, we've had experiences with family members being diagnosed with cancer, and it's just seeing the different journeys that my family members have gone through with their diagnosis, and really how the whole family as a unit had to come together to support that individual, that family member going through that diagnosis, but also seeing how the experience is really very different from different ethnic groups. So to me, that really sparked a curiosity of how can we really have a better understanding of what the factors are, both contributing to what we now know as certain types of cancers among certain Asian American ethnic groups, and how can we really best support families that are going through this kind of diagnosis. I've been doing research on cancer among Asian American populations for over 30 years, and it never ceases to surprise me when people are surprised to hear that cancer rates can be high. Certain types of cancers can be high in certain Asian American ethnic groups. And so I don't think we're doing a good enough job with getting the word out and raising awareness around the fact that there are certain cancers, and some examples of this that we're particularly concerned about that we're seeing are the rapidly increasing rates, high and increasing rates of breast cancer, especially among younger Asian American women. And in fact, Asian Americans collectively as a group now have the highest rate of breast cancer in the US when diagnosed at age under 50. As well as the high and increasing rates of lung cancer among Asian American females who've never smoked. And so I think the one broad message I think that I would want people to know is to understand that we're not immune. Cancer certainly is not blind to race, and there are certain factors that are placing some of our communities at higher risk of particular cancer. So I think it's important to be aware so that we can advocate for our own health, and I think it's important for the medical community to be aware as well.